Hi everyone, welcome to Gyna Geeks Kenya. This is Swabra Swale, and today we shall talk about the most conversed topic of late, which is weight loss surgery. To be specific, bariatric surgery. You've seen influencers, getting the balloon done, getting the surgeries done, and we are all here for it. We are all here for taking stock and taking control of our health. And so today we thought we'd talk about weight loss surgery and then add a spin to it. We are gynecologists after all. So today we'll add a spin to it and add pregnancy to it, because what happens, and sometimes we go out seeking these surgeries in the hope of actually getting pregnant, because we know that a weight loss journey would encourage fertility. So just to probably introduce the topic and just to demystify what is what, we have weight loss surgeries and there are different types. So we have a gastric balloon, and the gastric balloon is where you swallow a pellet, okay, and it goes into your stomach. We x-ray it and it's connected to a tiny little tube. It's usually done under, mild sedation. You don't have to be fully asleep. You can actually, some tablets are so small that you could just swallow them in an office setup. And then an x-ray is taken so that we make sure that the tablet is in position, and having confirmed that it's in your stomach, then we actually inflate it. And what are we using to inflate? We're using normal saline or a liquid so that it stays put and occupies space in part of your stomach, not all of it, part of your stomach. So if your stomach has like 500 mils, the balloon will take like 250 or 300 mils out of the size of your stomach, and that means eventually the amount of food you eat will have to reduce because there's no space for it. When is it digested or removed? So most of them, the outer material of a balloon is not going to be digested. It's made in such a way that it self-digests after 6 months, sometimes 1 year, depending on the balloon you've gotten. And automatically, you do not have to come for a removal. What happens after 6 months is the juices in your stomach automatically digest the covering of a balloon, and the water and everything just passes in your digestive system, and it is absorbed and it passes, and you will, yes, for lack of a better word, poo it out. Yeah, so that is balloon. The second type of bariatric surgery we're talking about is what we call the gastric sleeve. And the gastric sleeve is, imagine you have a banana, and this banana, along its curve, you just split it into half, and so that is your stomach, because it's shaped into a semicircle, and then you just split it into half. So it's a restrictive surgery in that you remove the amount of space that your stomach can hold. By default, you're losing weight from the inside. It is not liposuction outside. It is the amount of food from the inside. Then we have now the gastric bypass. And the gastric bypass, of all the three procedures, is, I think, the most complex in the sense that it is both a restrictive and malabsorptive. So what do I mean? We're taking this stomach of yours and then cutting it out, okay, or rather cutting it in almost half, and then we're also cutting out parts of your intestine and reconnecting some parts to some parts. I will not enter the detail, but I will insert a picture so that you have a clearer picture of where we're coming from and where we're going. It is also called the roux-en-y. It's a French word which also means a Y route. So basically you're now creating a Y instead of a normal, straight passage of your intestines. So that basically differentiates the weight loss surgeries, and then those are the procedures that are done from the inside, laparoscopically. There are other cosmetic procedures which I shall not delve into because that is not the gist of the conversation today, and we're talking about liposuction. And liposuction here is where the fat is just simply, removed out of specific areas, the fat cells actually. And so that shall be a discussion for another day.